Hi, and welcome to Your CornerStone and Health Live. I'm Dr. Willie Fieldhaber again with you here on this Tuesday. Our guest today is Stephanie Pratt.
Hello.
With REM North Dakota, and I'm excited to have her with us to go through what I think is some information that you're going to find really valuable, and a little more information about the services and healthcare in our community that people don't even realize is out there. So I met Stephanie here a few weeks ago. Her and a few members of her team were in our office at one of our in-office workshops, Unraveling Neurodevelopmental Disorders. It was awesome to have you guys with
Absolutely.
us, for sure.
Yeah.
And so one of the things that since we're a chiropractic slanted podcast here, I was going to ask Stephanie's what her thoughts are on chiropractic and maybe what her experience is, and if anything has helped her with adjustments in chiropractic here in the past.
Absolutely. So I've gone through chiropractic care my whole life in different phases, obviously, phasing in and phasing out. Not really understanding how that works. Some people say you should get adjusted every week, and some say every month, and not really understanding that. And when I went to the workshop with Dr. Willie here, he kind of went into a little bit of that, and then I'm now would you say a client here?
A member, sure.
So
yeah,
I'm
sure.
a client or a member here at
Yep.
at Dr. Willie's practice, and it's definitely helped. I don't have a lot of pain. I experience it here and there, but it's not as frequent. Also, I'm more focused throughout the day, which is wonderful.
Cool.
So we're kind of just, this is the first phase of it, so I'll let you know how it goes.
Yeah, awesome.
Yeah.
I'm gonna the one question that you asked, which is you alluded to, is like, how do you know what wellness is?
Right.
And I'm gonna answer that one
Okay.
before we jump into the
Sure.
REM discussion. But Stephanie had an awesome question. Her question was, she's been to a few different chiropractors she shared, and each one says something different.
Right.
Like you wellness, you should get adjusted once a week, or you should get adjusted every 2 weeks, or you should get adjusted 3 weeks or 4 weeks. The different answers.
Yeah, it's always different.
Like, what's the answer?
Yeah,
Right?
yeah.
And that's a great point. And so she asked me, how do you determine that, or what makes wellness? And so in our practice, we use the Insight neurologic scanning technology to evaluate the health and function of the nervous system. And really, wellness, one aspect of that is that when we use that nervous system scan to help people through their care get to a level of adequate and vital, thriving nervous system function, that's our first measure to get to that point. And then whatever it's going to take to help people stay at that point and keep those scans well is what people need.
Right.
And so some people really have difficulties, and they might need adjustments every once a week, or every 2 weeks, or every 3 weeks. It depends. So it depends on each individual. But structurally, one of the other things that studies show is that there are scar tissues or adhesions that develop around areas of your spine that are misaligned and not moving the way that they should be in 2 weeks. So general recommendation is that 2 week range because of those scar tissues and structure. But the functional part of our practice is so much, in measuring that nervous system function is where the life happens.
Right.
So we use that as more of a director because that really depends on your function, So anyway, that was pretty awesome to share that. So that's a great question that you had after that talk. Okay, so what I'm super excited about is I really, we chatted on the phone last Friday.
Yeah.
And I learned a lot about REM and their services, but my guess is that there's a lot of people listening that have heard of REM, but don't have a clear understanding of even what's provided, even though it's in Minot. And I've lived here for my whole life, basically.
Right.
And so well aware of it, and had kind of a vague understanding, maybe a little bit more than that, but not clear. And you did a great job of sharing that. So
Thank you.
yeah, so you're a program director with REM North Dakota.
Oh, I'm a program supervisor.
Program
and caseworker.
supervisor. Okay,
Yep.
I'm sorry. Program supervisor and caseworker.
Yep.
And so tell me about what the mission of REM, and a little bit about what drew you to this work, and
Sure.
what you put all your energy and the hours that you put into that.
Sure. Okay. So I'll start from
Sure.
the beginning and go forward. So I currently have individuals in my family who have disabilities, and they range greatly. They're very different. Not one is the same. So I've grown up around individuals who have disabilities and these neurodivergent disorders. And so growing up with them, and then when I was 16, I actually had the opportunity to take care of an individual with a disability who was nonverbal, and he could not even express anything through words. It was either sounds or facial, different faces that he would make. So, and that was really neat and rewarding. And so, as I kind of continued in that field, and then also having my own business out of the country and whatnot, I had a lot of individuals who had disabilities as well. And so when I was at a crossroad and I needed a career change, I actually applied at Human Services. And Human Services through North Dakota is a state agency. And individuals can go in there, or families can go in there and receive their services. So from receiving their services, they get assigned to like REM or Calyx or Easter Seals. And the individual and the family have the opportunity to choose who they want to go with. So then once they come to REM, our goal is, and our impact on their life is to give them the best quality of life that we can, as independently as we can. So even if that's with a little assistance, so far as like maybe they only need transportation, or maybe they need help cooking some of the meal but not all of the meal, or it could be as far on the spectrum to they don't really have the ability to do anything and they need full assistance. So we provide all those assistance from the most independent client all the way to on the spectrum, on the more severe side, to providing all the services necessary. So far as, you know, that client needs to get up, so we get the client up. That client needs medical assistance, maybe with like different procedures, we help them with that. We help them get dressed. We make meals for them, and we pretty much help them from start to finish if they're that far on the spectrum.
That's awesome. You had mentioned one of the goals is to help them enjoy their life in their independent setting as much as possible, and in the community as much as possible. Which I think is fantastic. So I love the wide variety of the services that you guys provide.
And we work on goals with them too. So every client makes goals every single year, and then we try and help them reach those goals to be as independent as possible. Whether that is something simple as hygiene, or that's something like a driver's license if they're that independent, or even getting out in the community more, or volunteering, or just getting them that socialization, because not all of them have the opportunities that you or I would to be as independent as we can be. So.
That's really fantastic. How do people know if they would qualify for this type of thing, or how would they, because that's one of the things that a lot of times families don't seek out help early enough. You know, caregivers don't seek out help early enough, whether it's a parent or it's a sibling or something like that, and maybe don't even realize that those services are available. So how would somebody find you guys, or what would be the steps to determine whether or not they would qualify for some of the services that you guys provide?
So there's a multitude of different ways to go about that, but if we're speaking from like a child's point of view, normally like the school systems will have them on an IEP, and then they'll receive services that way, and then they can go to Human Services and potentially see if they can receive more services. Or we have some families that just walk in and they pay out of pocket, and that's a lot more expensive for the family. But if they don't qualify for those services, that's an option. And we do have children, and then we have a range from young adults to senior citizens. So, but most of our clients come from the Department of Human Services, and they have a DDPM assigned to them, which is a state caseworker. And then they come to REM, and we do their whole OSP plan, and that goes to the DDPM as well. For they look it over, and then it gets accepted to the state. So
so state
it's a whole
services,
process.
And there's a lot of acronyms you threw out.
I know. I'm sorry.
That's all right. But that's the help that you guys provide, is people helping people navigate the system. And so that's really what you need. You need someone to help you work through that. That was one of the things that I had shared, and it's our viewpoint too, is that it takes a village.
It really does, an entire village.
All sorts of help from a variety of different viewpoints. We
Right.
practice that way for sure in the practice, involving other providers and in care and the teamwork approach, no doubt. But specifically in these cases, it takes help from all aspects.
Right, and we even help them with their medical appointments and all of their diagnosis there too. So we have a nurse on staff as a provider, and then we have a whole medical coordinator team who works with the clients and to take them up to appointments and surgeries, and I work closely there as well with my clients, and the whole village has to be in there, and everyone is so important in a part of that process. So, and sometimes as low as the employee is as a DSP, they contribute so much to these lives because they're working so hard with them every single second of the day.
Right. So a DSP is a direct service provider?
A direct support professional.
Direct support professional. Okay, so do you have enough of those?
We do not.
Okay.
There was never enough in our field, so we're constantly looking for more DSPs to help us out.
Yeah, so direct support professionals. Yeah, and that's so if this is something that you have a passion about of helping people. Clearly, Stephanie, this is one of your passions.
Absolutely.
Helping in this regard. But if you're listening, or somebody that is wanting to be something in one of those roles, feel free to reach out.
Absolutely.
We'll certainly post that. Jay will go ahead and get that posted on our after our talk, if we can get that done, so we can have a contact and this type of stuff, a website. Is there anything that that you would see that you like best about what you do? If you wanted to elaborate just for
absolutely.
Yeah.
So I absolutely love what I do. I love working with the clients day in and day out. I have a great staff team. They're just incredible.
So big shout out to your team.
Yeah, my team is incredible. And we work closely to give the best quality of life to every single client, to get them out in the community, to plan their health. I have one client, I can't elaborate on what his medical need is, but I have one client where he just had a procedure done and he has an upcoming trip. And it's just been so neat because we get these clients who are normally just sitting in a chair or sitting on the couch, and they don't really have a quality of life, all the way to a quality of life that you or I have. And it's incredible to see the progression and the constant progression and just transforming their lives.
Yeah. I think that's fantastic. The idea of there's a huge difference between surviving and thriving.
Yes.
And that spectrum is, we all should be working on that at different points of our life. And I love that you guys, can provide that and
absolutely
have a huge impact on that. And I know that's one of the things that, we talk about all the time in our practice here, is that
absolutely
you can get through life and struggle your way through, or there's options and help and a teamwork approach to help you thrive, and that's really what you want for everybody. Yeah.
We actually do annual meetings every year for each client, whether they're an adolescent or they're an adult. And one of the coolest things is when the DDPM with the state of North Dakota asks, so how's your year been? And we've seen such a transformation from a client who's just like, well, I've been sitting on the couch and eating popcorn and just, being so mundane, all the way up to, oh, I went to Hawaii last year. Oh, I've been out in the community. I planted a hall garden. My cat has a catio now. All these different things, and they're meal prepping and they're exercising regularly, and it's incredible. You see the joy on their face. Yeah.
That's awesome.
Yeah.
Well, life-changing for them and their families.
Right. It's just so transforming in the best way.
Right. Right. Help and the stress relief for everybody. So, excellent. Awesome. Well, is there anything else you'd like to share about RAM, or anything else that we should share with our viewers or listeners today?
So I truly believe in REM and Calix and all of the agencies who do what we do, just because we take clients or situations with challenges such as combative behavior or negative behavior or inappropriate behavior and outbursts, and we teach them redirection and de-escalation, and teach them how to live just life more smoothly in general. And it's just so neat to watch those transformations too, because we have clients who don't know how to navigate life without their disability, and then when they come into services, we're actively teaching and they're actively learning these new skills, and it's just really incredible to watch their lives. But a lot of it is maintenance and consistency. If you're not consistent with the clients, they're not going to grasp the concept. So sometimes it is every single day you're working on the same thing, and it can be tedious sometimes, but you're actually transforming their life in the smallest way.
Yeah, you had mentioned routine was a really important thing.
Yes, keeping those routines consistent and finding those routines. Finding those routines can be a really hard aspect for families and for people who are not used to dealing with individuals who have disabilities.
No doubt. I one of the things that I share pretty frequently with in the practice here with our members is miracles happen in maintenance.
Absolutely.
Like there's a lot of things that happen right away, but when you're consistent with an activity that's good for you, that supports you, whether that's exercising or eating right or mental health relief or affirmations or journaling, when you're consistent with that, the miracle happens over time.
It does.
The repetition of that. And so having someone to support people doing that, we all do that in our different roles, or we should be.
Yes, the Lord can move mountains, but sometimes we can't move those mountains without the consistency. You need that consistency. That's fantastic. Awesome. Well, thank you very much. Absolutely.
Stephanie,
thank you so much for having me.
It's been great. We'll certainly have this connection up for REM, and we might even put up a couple of notes for Calyx and the other. What was the other service that you mentioned?
So REM, Calyx, Easter Seals. There's some other ones like Independence Inc. And all community support services and RSI, but those are the main ones.
Perfect. Yep, I know some over there, Calyx too as well. So
and they run a wonderful program as well.
We need to get one of them on here. I think.
That would be awesome. Yeah, you should go through all the different services. Easter Seals is right over here.
They're next door. Sounds good. Well, thank you very much for listening. Thank you for being with me today,
thank you
Stephanie.
for having me.
We'll look forward to talking with you guys here again in a couple of weeks. Get outside and enjoy this beautiful June 25th day. Cheers.